I'm James O'Brien, and this is Low Back Pain Explained. Low back pain is essentially from one thing, and that's faulty alignment of the spine, or falling out of good posture. As we fall out of alignment, what can happen is two things. We can get an overstretching of tissues, and as things become overstretched, over time we'll start to get some micro tears, and that tearing will cause pain and irritation. The other thing that can happen is there'll be some form of impingement or compression. If we fall out of alignment in another direction, what will happen is the joints themselves will actually get overcompressed. And as they get overcompressed, they'll become irritated and painful. Another thing that can happen is the nerves themselves will become pinched. And as they become pinched, that'll also lead to pain and irritation. Now, there are three things to consider when we're out of alignment. And the first is the amount of time that we're out of alignment. For example, if I'm out of alignment and I'm pinching structures in my spine, the longer I pinch it, the more it would hurt. Just like if I were to pinch my skin here. If I pinch it gently for a minute, it might not hurt. But if I stayed there for hours, that would really start to hurt over time. Just the same, if I use this plastic bag as an example, and I'm out of alignment and I'm overstretching a tissue, the longer I'm there, the more the bag will start to stretch. And that's the same way the tissues in your body work. The longer you're there, the more micro tears that'll happen, the more pain and irritation. Just the same, if I'm frequently getting pinched or I'm frequently stretching, the more frequent I do those things, the more pain and irritation I'll have. So although I might not be here or here for a prolonged period of time, if I go there frequently, over time that'll lead to a greater chance of injury. Lastly, the more amount of force that goes into those positions of faulty alignment will generate more pain and irritation and really injury. All right, so if I were to take this bag and forcefully pull it quick, you can see how the bag stretched out. Like if I were to lift a heavy box out of alignment, then I could have some big problems. All right, or if I was forced into extension quickly, that would also cause some problems. Just the same again for the pinch example, the harder I pinch, the more pain there is. Next, we'll talk about the role of the hip joint and its role in preventing and treating low back pain. So the hip needs to be both strong and flexible to keep a healthy back. All right, let's talk about why. If I lack the range of motion, bending forward through my hip, then what I'll do is I'll get so far forward, then I'll compensate through my low back. I'll overstretch tissues, maybe cause some type of shearing and all of that. Basically, my spine falls out of alignment, I get pain. If I lack the ability to extend my hip, so this motion here is hip extension as I take my thigh behind me. If I don't have adequate hip extension in standing or walking, then what I'll do is I will arch my back like this. If I can't go through hip extension, I will compensate through lumbar extension, and that can cause pain. If my hip muscles are weak, all right, and particularly these side lateral muscles, if I lack the ability to stabilize when standing on one leg because those hip muscles are weak or I have poor control, then what will happen is I will compensate through my lower back. And you've probably seen a lot of people as they walk, they'll do this little lean thing. If I lack hip extension strength here using my buttocks, if I'm going to pick up an object, all right, I might extend through my back rather than my hips because those buttock muscles are weak. So it's very important that we have both a strong and flexible hip in preventing and treating low back pain. A huge goal in addressing low back pain is to do three things. We want to establish good alignment and good stability to stay there. All right, so we put our spine in alignment and we stay there. Secondly, what we want to do is we want to make a strong and flexible hip, so we're encouraged to move more through our hips with walking, bending, etc., rather than our spine. If we look at the pelvis here and we look at the spine, you can see that there's a very deep socket here for the ball and socket of the hip. All right, this hip joint is designed not only for an immense amount of stability, but also a lot of mobility. So when we bend and move, we should be getting much of our movement through the hip joint. In contrast, if we look up at the spine here, how these vertebrae float on top of each other on these discs, and then they connect at these what are called facet joints right here, those aren't inherently stable, all right? So Really, based on our anatomy, we should be moving much more through the hips and less through the low back. Unfortunately, we have a tendency, really from lots of sitting, which we'll talk about here in a second, to move more through our low back and our spine rather than our hips. And as a result, a lot of us have low back pain.